I wonder how many of you were like me. Even though I'd worked through the HIV and AIDS pandemic in the 80s and 90s, somehow or other, humanitarian crises were something that was over there. It wasn't something that really affected me. It was something you saw on television, you saw on the news, and you thought, wouldn't it be amazing to go and work there? But it really didn't touch me. And when I first started looking at the Syrian refugees in crossing all those borders, coming out of Syria in such huge numbers, I really started thinking about, but maybe it isn't just so far over there. Maybe it is much closer to where we are. And it really is with the COVID pandemic, with the rise in things like violence and crime, that made us realize that actually humanitarian crises weren't that far away. They were within our own countries, within our own district, and we're really only each of us a hair's breadth away from a humanitarian crisis. And so it's no longer anything that's over there. And we join together, as Moira said, both humanitarianism and palliative care meet in this common goal. We both are looking at how do we prevent and relieve suffering. But I was asked to talk about assessing the need for palliative care in humanitarian crises. And the need is both numbers and it is individual, it is human. If we look at figures that have come out from, first of all, the International Rescue Committee, where when they looked at just 10 countries that are on the international watch list for 2021, and of course it includes Afghanistan and Yemen and DRC and countries that we know where there are horrific needs, that's already 124, nearly 125 million people in need of humanitarian aid. And the ones that we look at very closely, of course, are those who are displaced. So of 80 million people who are displaced, 86% of them are in developing countries, where resources are low, where health systems are fragile, where often the political systems are changing constantly, and where we often know that palliative care is either non-existent or it is only seen in certain patches. And for myself, who's very involved in pediatric palliative care, which is my passion, if we look at almost 34 million children under the age of 18, it really says to us we need to be doing more from a pediatric point of view, and pediatric palliative care has got to be an essential part of the palliative care response. Then, thanks to Stephen Connor and to the Global Atlas of Palliative Care, we have an idea of how many people require palliative care every year. So that's nearly 57 million people. And again, where these people are mainly in low and middle income countries. If we look at 97% of children live in low and middle income countries, and 51% of these children are in Africa, it also says to us where we should be starting to plan as part of our strategy. But if you look at almost 50% of people who are dying who needed palliative care, are we anywhere near reaching them, even in the high resource countries? So what can palliative care offer? Of course, we know that we look at holistic care, we look at relieving suffering, serious health-related suffering through care of the body, mind, and spirit. And yes, that is so needed. We also know it's a human right, and human rights are not only in our countries, human rights are right there in the midst of a humanitarian crisis as well. How do we get it there? And thank you, Frank Brennan. And if we look at universal health coverage as being part of the aim of the World Health Organization of SDG 3, the health SDG, it is an ethical responsibility to provide palliative care as part of universal health coverage. So all of these are an indication of the need for palliative care in humanitarian areas. And so really, universal health coverage is not universal if it doesn't reach into refugee camps, into where migrants are gathering, into humanitarian crisis situation. Our challenge is to get it there. And we know that health coverage is not complete without palliative care. So again, the two of them coming together. And from WHO, when they spoke about COVID, they said both palliative care and a humanitarian response are needed in the world's response to COVID. Later on, Tamsin is going to be speaking to you about Cox's Bazar, so I'm not going to go into any detail, but that wonderful rapid review that was done there by Megan and Fazana and with Palchase involved shows us that the numbers, yes, are there, but also it's the need of each and every individual. And I think that is what calls to our humanity, not only as people, but as palliative care practitioners as well. We have to remember, it doesn't matter about the numbers, we have got to reach each person. And these people are like us. All of us could be caught up into naturally occurring hazards. And so the impact of climate change on both palliative care and humanitarian responses is going to be huge. All of these things could happen to us: extreme temperatures, storms, floods, epidemics. We're all in the middle of the COVID pandemic. And of course, really, we look at the man-made hazards. How can we control those? How can we get into these often really dangerous environments to provide palliative care? And of course, the main way is to integrate with other organizations that are part of the humanitarian health response. And so the question that Larry Beresford asked in his wonderful article is, what is and what could be our palliative care's role in humanitarian crises? We know that compassion is just so essential in all that we do. We know that palliative care can be incredibly innovative and getting into really difficult areas. It can help in guiding those difficult ethical decisions where so often resources are limited. Who receives the care? And of course, where triage is so important, palliative care, we have shown, can be integrated into each of the levels of triage. All of these really core principles of palliative care. We often have to go down to the absolute core of palliative care and try to do the simple things to make a difference. And then the staff support, the education and the mentoring, a huge challenge to us. But we're not going into it without resources. We're not going into it unarmed as it is. We have the WHO guide, which is really free to download from the World Health Organization website. And that is a very comprehensive guide that can help us, which includes an essential package of palliative care. Then that wonderful field manual, and thank you to Elisha and to Marcia, the editors, and so many who contributed, and especially to Oxford University Press, which has given it to us free and online. And then, of course, when we had that series of briefing notes and webinars, we had one specifically for palliative care in refugee camps and humanitarian crises. And this can be downloaded from WHPCA and from IAHPC. And then we do have examples. So we're not starting from zero. In many, many countries in the world, from what is happening in Bangladesh that you're going to hear more about, to the war zones in Ukraine, to the borders of India and Nepal, we are seeing people providing palliative care. And so, of course, we know that there are things that we can copy and adapt and change when we look at providing palliative care in humanitarian crises. And we have various networks that are developing around the world, looking at this as almost a new field in the world of palliative care. So if you can join one of these networks, you can become part of the answer to the question about how we provide palliative care in humanitarian crises. And so wherever there are humanitarian crises where people are involved, palliative care is a humanitarian imperative. And so I think we are challenged. We are challenged to see what can we do, how do we do it, and how quickly can we do it.